Right on then, and also take cognizance of what's going on with Narayana Health. We've got Mr. Viren Prasad Shetty, who is the Executive Vice Chairman, here with us to discuss the growth outlook. Thanks so much for taking time out. What about occupancy levels? Let's start off with that. How's that shaping up? Because there have been a lot of, flu-related diseases and those associated with flu, etc. What has that taken your overall occupancy levels to?
It's not moved it by an appreciable amount. Obviously, the number of occupied beds fluctuates depending on the season. And yes, you're right. The seasonal diseases like dengue and flu tend to fill up our MICU, but not enough to change the overall occupancy numbers. On a group level, we are on generally about between 65 to 68% occupied at this time of year.
Okay, fair enough. What about the latest updates regarding the newly commissioned radiation oncology block in Cayman Island? How is that contributing to your FY24 revenues?
We don't break out the numbers of the individual component. The radiation is part of a larger expansion that we're doing in Cayman. Radiation oncology is one part of it. It is done far in excess of our estimates for what a new block should do, because there was a huge latent demand for patients who had signed up for cancer treatment in the US but decided get it done in Cayman. So the outlook is very encouraging, and we're hopeful that as it ramps up, the volumes will be quite additive to the overall performance of that hospital.
Sure. The last time that we were chatting, you were talking about as to how inflation headwinds and gross margins is something that you foresee in the near term. Can you share with us the latest update on this regard? Any change, any impact in the near term consolidated margins that you foresee?
None of these are a short term. These are all just long-term trends that will permanently reset the cost structure of our business. So, for example, construction costs today are nearly 50% higher than before the pandemic. Cost of labor has gone up, cost of material, cost of a lot of heavy engineering equipment has gone up by a lot. Similarly, a lot of the large medical equipment that we used to import has gone up in price, not only because of the rupee depreciation, but also because the cost of all their individual components have gone up. So anywhere from 15 to 20% cost increase in heavy medical equipment. The drugs and disposables, as such, anyway, year on year, they take 5 to 10% cost increases. And that's something all hospitals have to contend with. The biggest component apart from that is salaries, of course. That has taken quite a lot of hikes, but deservedly so. We do want to pay healthcare workers a lot more in a post-pandemic era. And in order to make the sector more attractive, we have to pay more for doctors and nurses. All of this reflects on the cost that a lot of hospitals will eventually have to start charging.
Right. And could you also tell me what's really happening with your ongoing capex? What's the timeline looking like? Where do things stand as of now?
So we had budgeted for about 1,000 crores in consolidated capex for this year. We are on track to spend most of that. The bulk of it will be in our Cayman expansion. There's some amount that is set aside for a little bit of renovation in our Bangalore and Calcutta hospitals, which is also on track. The amount of capex that would be spent would also be significant for the next couple of years, because we are looking at doubling our capacity to treat patients in our Bangalore and Calcutta hospitals, both through a combination of brownfield as well as renovating of our existing campuses.
Okay, fair enough. What about the Mumbai hospital? Because that is expected to break even by the end of FY24. Can you walk us through whether or not you're on track or on that timeline, or is there any latest number on the sales from that unit that you'd like to share? I know you don't give individual breakups, but perhaps an indication as to how it's performing?
We're on track for that. That hospital does break even on some months it doesn't. So, for example, during the summer holidays, kids generally don't come in. And so it will be making a slight bit of EBITDA losses in months during flu season and the winter time. It tends to go up again. So it's more or less there. It's just a question of steady state EBITDA break even should more happen by the end of this fiscal year.
Right. What about the India ARPOB growth? Because that's been aided by the better payer and case mix. How do you see Q2 numbers?
Again, without getting into projections, this is part of this long-standing work that we've done in our efficiencies, in reducing length of stay, in moving into higher-end surgeries, as well as a lot of things that we can do to improve the realizations of certain procedures. So that, again, will proceed in a graduated manner. Normally, a yearly price increases are about 5%, thereabouts, that the rack rates increase. But then more of the ARPOB increase comes by changes to the O. You improve the occupancy by reducing length of stay, by discharging people faster. You can improve ARPOB by a lot more than that.
Okay, just walk us through the outlook as well in terms of, I know you spoke of your capex plans, but can you just tell us a little bit more about, the onco block, the cath labs that you're looking to add, and what the plans are in terms of the high-performing regions like Bangalore, Kolkata, etc., in terms of your growth visibility?
There is tremendous amount of demand for the services that we offer throughout the country. But what happens with going to a new geography is that you start with a very expensive upfront investment in greenfield capacity, and it takes 3 to 5 years to break even. Whereas we have existing infrastructure. Nearly all of our hospitals are struggling to fill the demand that already comes. Now, it may not all of it be in terms of beds for people who've had surgery. A lot of the demand for this comes from people wanting daycare procedures, for people wanting a different category of room, for outpatient space, for a lot of diagnostic and ultrasounds and x-rays. So a lot of the investment that we'll be making over the coming years and have been making the past few years is just rationalizing a lot of the infrastructure that's already there by doing up the interiors, changing the layouts of outpatient areas, adding MICUs, adding oncology. So this has a much smaller price tag. It gets operationalized much faster. It breaks even almost instantly. It is operationally complex because one of the most difficult things to do is to add infrastructure to a running hospital, but it's something that is desperately required because the last big capex cycle that we took was more than 7-8 years ago. And so this next phase would not be adding any more bed capacity, but will be going towards improving what we already have. We are looking at adding more beds also in Bangalore and Calcutta, but that is a much longer duration project. That is something that will take 3.5 years to come because it requires a lot of planning, execution, design approvals, permits, all of that.
Good to have you on board. Thanks so much for taking time out and joining in. Time for a very quick break right here on the show. Be right back with Chartbusters.